voluntary euthanasia, distinct from physician-assisted suicide, in that the physician takes a more active role when assisting in the voluntary death request of a patient. This is a controversial ethical topic that has been and will be greatly debated. There are those who posit that voluntary euthanasia is ethical based on the grounds that it respects autonomy, it provides relief from suffering, and that pragmatic considerations of limited healthcare resources and associated costs are inherent to the discussion surrounding voluntary euthanasia. Then there are those who oppose voluntary euthanasia on the basis that it undermines the sanctity of life, that it has the potential to lead to involuntary euthanasia, and they argue that there are alternative options, such as palliative care. When considering respect for autonomy, those who argue for voluntary euthanasia generally agree that accessibility can be a barrier for those who cannot physically end their own suffering. Voluntary euthanasia respects the inherent dignity and personal values of individuals, allowing them to exercise control over their fate when faced with unbearable pain or loss of quality of life. Voluntary euthanasia can also be seen as an act of compassion, as it provides relief from suffering. In cases where individuals experience excruciating pain, loss of bodily functions, or the inability to engage in activities that bring joy and fulfillment, euthanasia can be viewed as a benevolent and merciful option. An alternative viewpoint suggests that due to the extensive medical resources and interventions required by terminally ill patients, coupled with the high cost and limited accessibility of palliative care, it is reasonable to argue that offering voluntary euthanasia as an option can alleviate the financial burden on patients. By allowing them to forego treatment and embrace their remaining time with dignity, it enables a reduction in incurred debt. There are those who argue that life is inherently sacred and that any act that would result in ending one's life is morally unjustifiable. They contend that intentionally causing death, even with the consent of the patient, violates the fundamental principle that all human lives are sacred and should be preserved. Thus, they perceive voluntary euthanasia to be unethical. Critics of voluntary euthanasia also believe that if legislation were passed permitting this act, that it would eventually be used in unintentional ways, such as involuntary euthanasia. Moreover, there is apprehension that societal acceptance of voluntary euthanasia may lead to the devaluation of human life, particularly for vulnerable populations, such as elderly, disabled, or mentally ill. Lastly, opponents of voluntary euthanasia contend that the focus should be on improving palliative care and providing comprehensive support for patients nearing the end of their life. They believe that investing in end-of-life care, such as pain management, psychological support, and holistic care, can meet the needs of patients during their final stages of life. In conclusion, the ethical debate surrounding voluntary euthanasia remains contentious. Supporters argue that it respects autonomy, provides relief from suffering, and addresses limited healthcare resources. Opponents emphasize the sanctity of life, the potential for misuse, and the advocate for improved palliative care. The complex nature of this issue requires open dialogue and compassionate consideration to navigate this ethical implication. When we talk about death, historically, one thing that we have tried to determine is the nature of death. Cardiac death, which is the complete and irreversible cessation of all cardiac activity, has been the accepted term used when determining death. So, according to this standard, when a person's heart stops beating and ceases to function, they are considered dead. However, in recent years, neurological death has become an acceptable way to also determine death. Neurological death, commonly referred to as brain death, is the cessation and irreversibility of neurological activity. Brain death is determined by a thorough evaluation of brain function, including the absence of reflexes, no electrical activity in the brain, and the inability to regain consciousness. The definitions and criteria for death have been shaped and influenced by culture, legal, and societal factors throughout history. Culture and religious factors have played a role in how we understand death by influencing its meaning and significance. Legal systems contribute to the societal understanding of death by establishing the criteria for declaring death. Societal factors such as advancements in medical technology and changing societal attitudes also influence the definitions of death. As medical knowledge and capabilities evolve, the criteria for determining death may be reevaluated and revised. One particularly important area of healthcare that is impacted by defining death is organ transplantation. Organ transplantation often relies on organs from individuals who are declared brain dead, but whose organs remain viable. This raises ethical dilemmas and challenges. We must consider that when removing organs for transplanting, timing is crucial. When considering the cardiac standard, since the heart is typically necessary for organ transplantation, concerns have been raised that artificial life support sustains other bodily functions, making it seem as though it is alive. When considering neurological death, the criteria may vary across different jurisdictions, leading to inconsistencies and uncertainties. Disagreements amongst medical professionals regarding brain death protocols can create ethical dilemmas and undermine public trust in the determination process. In conclusion, the definition of death is influenced by cultural, legal, and societal factors evolving from cardiac death to include neurological death. This has implications for organ transplantations, raising ethical dilemmas due to varying criteria and disagreements among medical professionals. And ongoing discussions are necessary to ensure that ethical practices and maintain public trust in determining death.